broken bones, lost limbs, malnutrition, cancer, and death. All serious problems that shipyard and steel mill workers face on a daily basis. During the early 1940s, Kaiser derived from industrialized health programs for construction workers in fields such as shipyards and steel mills. This health program was started by a young surgeon, Sidney Garfield, in a small 12-bed hospital. Sidney Garfield was not only a surgeon, but was also a businessman who saw huge potential towards the hospital plan by investing in the thousands of men building the Colorado River Aqueduct project. Seeing potential with this aqueduct project, he invested in a loan to build a hospital 6 miles from this project. After going through the process of getting his loan and building his hospital, he started to treat sick and injured workers who would come in with broken bones, burns, and serious illnesses. Though he was helping the workers, their personal insurance providers weren't paying their treatment bills, and Sidney Garfield started having financial struggles because of this. Although Sidney Garfield was having financial problems, he wasn't turning away workers. As Sidney Garfield started having major struggles, there was one man who still saw huge potential in Sidney's hospital. This man was Harold Hatch. Though Harold Hatch was originally engineering, he changed his career to be an insurance agent, and this saved the company. Harold suggested to have Sidney create an insurance plan, his insurance plan within his company. This would give every worker a fixed daily amount to pay that would help relieve money troubles. This gave birth to the Kaiser prepayment plan. With a prepayment plan, workers would only have to pay 5 cents a day, but this would give them coverage outside of work also. All of these prepayment methods caused thousands of workers to enroll. Now, not only were workers getting help with work injuries, but they could go home, get hurt, and still have help and health coverage for them. Though Garfield was receiving a steady stream of revenue from the aqueduct project, the project eventually finished and he had to find new investments. At first, Sidney Garfield believed investing in a big city like Los Angeles. This would give him a steady stream of work, but he didn't, so he decided to put his practice in LA on hold. After putting a hold in LA, Sidney Garfield started investing in the Desert Center. This would be a state-of-the-art treatment center that was not only personally ran by Garfield, but also recruited doctors on a salary. At the time of Garfield's highest peak at his treatment center, World War II broke out. With Garfield having experience in shipyards, he redirected his medical care into the war. Shipyards where many workers were inexperienced and in poor health and desperately in need of medical attention. With the war breaking out, the shipyards were overwhelmed with workers in need. With so many servicemen needing help, Sidney Garfield had to reach out for himself. Garfield reached out to Harold J. Kaiser, who eventually pushed Garfield in such a positive way that they were able to take the simple health care Garfield was providing into a huge corporation. By the time Kaiser started helping Garfield, he was caring for over 30,000 servicemen and women. These 30,000 servicemen and women started becoming a problem, and there wasn't enough space or resources. Everyone was spread out, which caused long trips between servicemen. When Kaiser saw the problem of distance and time, he came up with a solution by combining the prepaid program with a practice specifically for workers and education. With Kaiser's idea to provide a center with prepaid services, it caused a boost in revenue. Eventually, Kaiser and Garfield built another location in the Bay Area, which started the Kaiser chain we know today. With these locations only working with servicemen and shipyards, servicemen and shipyards, their patients fell from 90,000 to 13,000. Once the war was over, with Kaiser and Garfield wanting to continue their work post-war, they decided to open the Permanente Health Plan to the public. When this was open to the public, there was only one goal in mind: to be the leader